Proteinuria, that is the excretion of protein in urine. When protein appear in urine in detectable quantities, it is known as albuminuria. Because albuminuria इसको हम proteinuria क्यों कहते हैं? Because albumin is rarely found alone in urine. Therefore, the term proteinuria is preferred. The protein found in urine in kidney conditions, you know it very well, are commonly plasma protein that pass through the damaged renal epithelium. Whenever there is a renal damage, obviously the filtered protein will not be reabsorbed and they will appear in the urine. दूसरी बात ये है कि albumin having smallest size pass most easily. फिर उसके बाद globulins जाते हैं and fibrinogen least readily. क्यों? यार if you memorize it, if you remember, वो resistance करते हैं flow को. Therefore, they are the least readily passable molecules. It is classified, proteinuria is classified under two headings, functional proteinuria and organic proteinuria. Functional proteinuria which are not related to the diseased organ. The amount of protein excreted is usually less than 0.2% and the condition is usually temporary. Causes: violent exercise. Soldiers after marches, वो उनकी kidneys के ऊपर there may be a slight kidney damage, but the condition almost manageable. ठीक है? Athletes होते हैं, जाहिर है उनकी kidneys के ऊपर जोर पड़ता है, damage होता है हल्का फुल्का, but condition is manageable because it is not a disease. It is due to the physiological effect, you can say. Cold bathing. Exposure to cold may cause proteinuria, which is temporary. Kidneys are not involved and need no treatment. ये ऐसा नहीं होता है कि आप ठंडे पानी से नहा लोगे तो हो जाएगा. Cold bathing, जो cold water में अगर कोई काफी देर तक रहे, मुस्तकिल रहे, कोई टारगेट हो उसका कि मुझे ये काम करना है cold water में, ठीक है, तो उस कंडीशन में होगा. ऐसा नहीं होगा कि आप ठंडे पानी से नहा लो तो आपको प्रोटीन्यूरिया हो जाएगा. Alimentary proteinuria after excessive protein ingestion. Pregnancy it put a pressure on the renal veins and therefore due to the pressure the protein is excreted in urine. Orthostatic or positional, postural positional proteinuria. These occur in children or in adolescents, usually 14 to 18 years age. In these young individuals, the urine contains protein when they are in the upright position only. ये भी सिर्फ ये नहीं है कि एक दिन आप खड़े हो गए तो proteinuria हो जाएगा, ऐसा कुछ नहीं है. बल्कि suppose a person is doing such a job कि उसको खड़ा होना पड़ता है बहुत लंबे टाइम के लिए. Supposed to stand for a long time. The nature of the job is such that. So they may suffer proteinuria. However, it is cured or it is removed when they are in the proper normal position. This is not due to the kidney disease, but is probably due to some disturbances in the blood supply to the kidneys, right? So it is due to the position. Kidneys are not damaged, but the blood supply, there is some disturbance in the blood supply to the kidneys and therefore the proteinuria, it occurs. Organic proteinuria. There are many pathological conditions that cause organic proteinuria, which may be classified into three major groups: pre-renal, renal, post-renal. Pre-renal. Proteinuria is not related to the kidney directly. Okay? Conditions causing proteinuria of this group are those primarily not related to the kidney directly. In most cases, they affect the kidneys in a way कि they make them more permeable to the protein excretion. ठीक है, प्रीनेनल they are not related to the kidney directly, लेकिन कोई दूसरी बीमारी है जिसकी वजह से kidneys they become permeable to the protein molecule. For example, cardiac diseases by affecting the circulation of kidney leads to proteinuria. Any abdominal tumor or mass of fluid in the abdomen exert pressure on the renal veins and affecting its circulation leads to proteinuria. यार इससे एक बात देखो हमने समझ की है कि whenever there is resistance or difficulty in the flow of blood through the kidneys to the renal vein, then the proteinuria occurs. Not this not only के renal damage हो तो proteinuria होगा, even if there is some hindrance to the blood flow or the blood flow to the kidney is not proper, then also the proteinuria occurs. Fever, anemia, other blood diseases, liver diseases and many other pathological states can affect the renal circulation and leads to proteinuria. So remember one thing, कि renal circulation, whenever the renal circulation is compromised, then this results in the proteinuria. Cancer, collagen diseases, inflammatory condition leads to increased amount of urinary mucoproteins due to elevated serum mucoprotein levels. So, pre-renal, now we come to the renal. Proteinuria are found in various types of kidney diseases, and this is known as renal proteinuria. Acute glomerulonephritis is always associated, that is, the glomerular function filtration is not proper. Chronic glomerulonephritis, kidney tubules are not functioning properly. Proteinuria is seen in early stages but may disappear later as kidney become more and more impaired. Nephrosclerosis. Nephrosclerosis क्या होती है? Hardening of the walls of small arteries or arterioles supplying blood to the kidney. यानी वो arteries या arterioles, arterioles कहते हैं जो arteries से भी small होती हैं, fine arteries, which are supplying blood to the kidney, their wall, they become hard. And this condition is usually caused by hypertension or carcinoma of the kidney. ठीक है, दूसरा होता है in nephrotic syndrome. Large quantities of albumin is lost in urine and there may be gross hypoalbuminemia. Polypeptide, proteases, peprones sometimes are excreted in urine, and ये मैं आपको नहीं बताऊंगी because you know that these are the dry proteins, hydrolytic products of the protein. This may happen in pneumonia, diphtheria, carcinomas in protein-containing material. Example are tissue mass और a pus, उसकी breakdown हो रही है. ठीक है, देखो मैंने अभी आपको बताया ना, these are hydrolytic products of the protein. ये कैसे आ रही हैं यूरिन में यार? Some protein-containing material, right? It's going hydrolysis. Autolysis means the breakdown of the protein, right? And in this way, they are excreted in the urine. Post-renal. Protein are added to urine after it is formed. समझ में आया? शुरू से नहीं होता है यार, यूरिन बन गया उसके बाद जो है उसमें प्रोटीन्स ऐड हो गए. It occurs with inflammation of the urinary tract. Common conditions associated with post-renal proteinuria are urinary tract infections, nephrolithiasis, kidney में stones हो जाते हैं, and tumors of the urinary tract. In these conditions, it is observed. Post-renal proteinuria resolves as soon as the conditions are cured. then this proteinuria is dissolved.